effort to spread anti-coronavirus vaccine messaging, Candace Owens accidentally asked a pretty good question about healthcare in the United States. She did so through a tweet, which I'll share with you right now. She wrote, quote, "The COVID vaccine saves lives, which is why the government is making it free." Now, she's quoting people who make that argument, and her response to it is, "K, so explain to me why insulin and asthma inhalers cost so much money. If the vaccines are really about the government trying to save your life, why do life-saving medicines cost so much?" Well, you know, that's actually a really great question, Candace. I mean, she's a member of the media. She's supposed to have some obligation to be an informed individual who then informs her audience. But of course, that's not the case, especially when it comes to important bread and butter issues like healthcare and other commodified institutions in the United States, which really should be thought of as a human right. But just to give her a short one-word answer, the reason is capitalism in both cases. Capitalism is what fuels the vaccine for coronavirus being free. Capitalism also fuels this disgusting, incredibly corrupt healthcare system in America that unfortunately doesn't really serve the best interests of Americans. So first, let's start off with why the coronavirus vaccine happens to be free. Is it because the American government wants to do the right thing and they want to take care of their citizens, and that's just it? It's just all about morality and doing the right thing? No, there is a real financial incentive in ensuring that Americans get vaccinated and the spread of coronavirus either slows down or stops. Because guess what? When you have an incredibly contagious virus, the so-called human capital that's necessary, meaning the labor that gets exploited by corporations to help them earn revenue and turn profits, well, that's jeopardized, and we can't have that. In fact, we got to do a little bit of a rewind to understand what I'm saying here. So before I do that, though, I think this is a perfect opportunity to take a little visit in the debunker.
You didn't see Republicans, when we had control of the Senate, try to rig the game.
Shows how the Green New Deal would be a deadly deal for the United States of America.
Our systems are not racist.
The coronavirus vaccine is free because of the chart that I'm about to show you. This is the chart showing what happened to the stock market as the coronavirus pandemic led to closures in the United States. Of course, I'm talking about business closures, which hurt the bottom line for corporations throughout the country, with the exception, of course, of corporations that allow people to work from home. Companies like Zoom, for instance, did incredibly well during the pandemic, but the stock market took a plunge, took a massive plunge. Okay, they call them dumps, big dumps, as Donald Trump would say. And so corporations are freaking out. They're like, man, the closures are awful. We need to slow the spread. And then once they realized, oh, you can't slow the spread, it's too hard, let's start urging lawmakers to open businesses back up prematurely and get people back to work. And the conversations that were taking place in early 2020, in the beginning of this pandemic, were just so transparent. In fact, people like Kevin Hassert were overt in their rhetoric regarding labor and how corporations and the U.S. government really viewed workers. Take a look.
We don't have, our capital stock hasn't been destroyed. Our human capital stock is ready to get back to work. And so that there are lots of reasons to believe that we can get going way faster than we have in previous crises.
Our capital stock is totally fine. Our human capital is totally fine. Let's get them back to work. Now, mind you, this was early on in the pandemic. There was no vaccine. There was still a lack of clarity regarding masks, and there was all sorts of disinformation about the pandemic. But you have Republican lawmakers, members of Trump's administration, urging for Americans to prematurely go back to work and put their lives in danger in order to ensure that the stock portfolios of the elites in this country aren't harmed by this global pandemic. Now, that was followed, by the way, with, various governors, right-wing governors, the lieutenant governor of Texas, Lieutenant Governor Dan Patrick, of course, urging even elderly people to get back to work, which was absolutely hideous and disgusting. Now, luckily, most states continued with the shutdown. Some states did open prematurely, like Texas and Florida, for instance, and there was a price to pay. We have now over 600,000 Americans who have died as a result of this pandemic. Now, why was the Trump administration and now the Biden administration doing whatever it takes to develop a vaccine and get as many people vaccinated as possible? Well, because they want people to get back to work, guys. And in order to get people back to work, in order to incentivize getting the vaccine, you should make it free, right? I mean, you don't want to provide some sort of obstacle to people getting vaccinated. Now, let's get to the next video because I think that's also telling.
I'm also pleased to report today that a vaccine candidate has begun the phase 1 clinical trial. This is one of the fastest vaccine development launches in history, not even close. We're also racing to develop antiviral therapies and other treatments, and we've had some promising results, early results, but promising, to reduce the severity and the duration of the symptoms. And I have to say that our government is prepared to do whatever it takes.
Our government is willing to do whatever it takes. Donald Trump didn't really care about the well-being of the American people. What he cared about was getting a vaccine, making sure that people get vaccinated so they get back to work. That's what that's about. Now, to the second part of Candace Owens' question, right? Why is the coronavirus vaccine free? Remember, we're talking about a contagious virus that has killed hundreds of thousands of Americans, while other medications are not free. And she mentions insulin, diabetes, and all that. Well, diabetes is a big problem in the United States, but it's not part of a pandemic. It's not a contagious virus. And so when it comes to other illnesses that Americans are suffering from, that's when capitalism also plays a role in incentivizing price gouging to ensure that the healthcare industry and the private pharmaceutical companies make as much money as humanly possible off of the pain and suffering of Americans. And we see that happening over and over again. So why don't we take a quick look at how much Americans pay for pharmaceutical drugs compared to other countries?
Let's look at 5 of the top-selling prescription drugs in the world. Advair, a brand name asthma inhaler, more expensive in the US. Lantus, a type of insulin, more expensive in the US. Sovaldi for hepatitis C, costs more in the US. Humira for arthritis. Crestor for cholesterol, more expensive in the US. So here's an unsurprising chart. Americans spend more on prescription drugs than anyone else in the world.
Now, why is that? Why do Americans spend so much more on pharmaceutical drugs than other developed countries? I mean, I thought America was number one. I thought we were the best. I thought we had the best economic model ever. Capitalism reigns supreme. Except when it comes to commodifying things that we need for survival, maybe capitalism isn't such a great idea. In fact, that Vox video continues on to express why it is Americans end up spending more on pharmaceutical drugs compared to other countries.
In the UK, the government buys the stock of medicine for the country. That means they're usually able to get a lower rate, kind of like a bulk discount, which keeps prescription drugs cheaper for UK citizens. In almost every developed country besides the US, this is what the system looks like. Safety evaluation, assessment of whether the country needs it, price negotiations, sold to patients. Now let's look at the system in the United States. First, the drug is evaluated for safety, but that's it. If it's safe, they can sell it, end of story. Drugs are sold by the drug companies to patients, usually through insurance. And since the US system lets them sell it for any price, Gilead, the company that makes Sovaldi, charged Americans more for it. When it first came to market, the entire treatment cost $84,000 in the US. In the UK, just about $58,000 US dollars. That's still a lot of money, but it's a full 30% less.
Now, there's an important caveat to the figures that were just shared in that video. It doesn't take into account health insurance, which works very differently in the United States versus the UK. As we know, it's a privatized model here in the United States, with some exceptions for elderly or disabled people. Medicare is something that luckily elderly Americans can take advantage of. But outside of that and statewide Medicaid programs, Americans unfortunately have to resort to private insurers. And what do private insurers want more than anything? To turn a profit. It is a model that incentivizes profit. And that means cutting costs to increase profits. How do you cut costs? You deny coverage for things like pharmaceutical drugs or coverage for procedures that need to be done, medical procedures, of course. The model in the UK is actually very different, and I would argue is a far better model, because the figures that were shared in that video do not indicate what patients in the UK actually have to pay out of pocket for that particular drug. At the center of the UK system sits the National Health Service, founded in 1948. The NHS goes beyond single-payer healthcare into truly socialized medicine. The government doesn't just pay for services, it also runs hospitals and employs doctors. The system is financed through taxes, everyone is covered, and supplemental private insurance is rare, meaning that the care that individuals in the UK need is free at the point of service. Whereas in the United States, Americans literally skip their yearly physicals or even seeing a doctor when something ails them because they're worried about going bankrupt if it turns out that they're actually very sick. I mean, we live in a sick system. And Candace Owens, to her credit, wants to learn about it. So I'm glad that she's giving me the opportunity to explain it to her. Now, why is it that we maintain this awful, awful system? Especially when we've had proposals from wonderful lawmakers like Senator Bernie Sanders to switch us over to a single-payer healthcare system, which of course gives us more power to negotiate lower drug prices. Well, we also have a system of legalized bribery here in the United States, and I want to just give you a little taste of how much pharmaceutical companies and private insurers lobbied in recent years. So spending on pharmaceutical industry lobbying reached a record amount in 2020 at more than $306 million, compared to just $299 million in 2019. There were 1,502 pharmaceutical lobbyists in 2020, 63.58% of whom were former government employees. Because not only do we have a system of legalized bribery, we also have that revolving door where lawmakers leave Washington to then lobby for various corporations. And they've got the connections. They can hit up their former colleagues in Congress and be like, yo, let's defeat that bill. Let's ensure that we don't have a healthcare system in America that actually works in the best interests of the American people. Now, I'm not done yet. As I mentioned, in the UK, they have the National Health Service. It's certainly much better than what we have here in the United States. Now, in 2016, the Commonwealth Fund actually surveyed 11 high-income countries about cost-related barriers to care. And Americans were actually the most likely to skip needed care because of costs, which 33% have done so over the past year. That's what they found in the study. They also found this. Residents of the United Kingdom were among the least likely, with only 7% saying the same. The same was true notably of dental care, which isn't covered by private health insurance. You have to buy dental care separately in America. 32% of Americans said they skipped needed dental care services due to cost, while only 11% of Britons did the same. By the way, we also happen to spend a lot more for the crappy healthcare model that we get here in the United States compared to the UK. I mean, a huge argument is, well, how are you going to pay for a single-payer healthcare system? It sounds real expensive. No, it's actually not the case. That's a lot of propaganda and misinformation. In fact, in 2016, healthcare spending in the United States equaled more than 17% of the country's GDP. That's gross domestic product, while the share of health spending in Britain was only 9.7%. It's pretty fascinating. And what adds insult to injury, Ms. Owens, is the fact that Americans are not only price gouged by these pharmaceutical companies, Americans pay more for these pharmaceutical drugs than any other developed country. We also spend money on the research and development of the very drugs that then turn around and we get price gouged on. So AOC actually addressed this during a House Oversight Committee hearing about 2 years ago, because she wanted to talk about R&D spending, but also what these pharmaceutical companies tend to do with their profits. Let's watch.
A lot has been made about how much money has been spent on research and development. Between 2006 and 2015, about $465 billion was invested in research and development. I think every dollar put into research and development of pharmaceuticals is a good dollar spent. But Let me see, Mr. Mitchell, are you familiar with stock buybacks?
I know what they are.
And what is a stock buyback?
It's when a company decides to purchase shares of its stock in order to drive up its stock price.
So between those roughly 10 years, $465 billion was spent on research and development. The amount that pharmaceuticals spent on that same time to buy their own stock for the sole purpose of driving up the price was $516 billion. So they spent more than their entire budget on research and development on a tactic to drive up their own stock price.
And of course, executive pay is tied to the performance of the stock. So if the stock does well, the executives get paid more. And that's part of the reason why so much gets invested in buying shares of the company's stock. And when you want actual figures in regard to how much Americans spend in the research and development of the drugs that we need but can't afford, I want to give you those numbers. A Center for Integration of Science and Industry, this study underwritten by the National Biomedical Research Foundation mapped the relationship between NIH-funded research and every new drug approved by the FDA between 2010 and 2016. Here's what they found. The authors found that each of the 210 medicines approved for market came out of research supported by the NIH, meaning the taxpayers. Of the $100 billion it spent nationally during this period, more than half of it, $64 billion, ended up helping the development of 84 first-in-class drugs. So taxpayers fund research and development for these pharmaceutical drugs, and then we can't afford them because we have a model in America, a capitalistic model, that calls for privatizing the gains, meaning the profits, and socializing the losses. So there is socialism in America. It's just corporate socialism. It's socialism that takes money from all the workers who are already exploited, and it floats up to the top. We redistribute that wealth all the way to the top, to the very people who don't need it. Because if you need money, if you're someone who's strapped for liquidity and cash, you're not going to be buying shares of your own stock. But pharmaceutical companies get to do that. That's legal in America. It used to be illegal. And they're also able to charge Americans whatever the hell they want for these drugs. So that's why this system is broken, Candace. Hopefully she watches this video and has a better understanding of how capitalism really works. My guess is, based on previous statements that she's made that were just not so smart, I'll be generous, she's probably not going to absorb this information. But hopefully anyone who questioned this model and thought that we were number one in healthcare in the United States, maybe you change your mind a little bit. Maybe you read into it a little more and understand that Americans are needlessly dying because of capitalism. Americans get the vaccine for free because of capitalism. Because to corporations, Americans, workers, are nothing more than human capital to be exploited to help them earn a profit. That's it. That's all it is.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.